Eczema is a condition in which patches of skin become rough and inflamed, causing itching and bleeding and typically having no obvious external cause. So with no external cause, isn't there a better treatment than external creams and ointments? Here's my friend and colleague, Dr. Michael Berglund, with a wellness approach to eczema.
Eczema is an inflammation of the skin. It can be localized to certain areas or it can be throughout your body. But most of you probably aren't listening to this to try and hear an explanation of what it is. You'd like to know, how on earth do I get rid of this, right? So the inflammation happens on the surface of the skin, but it's not coming from the skin, okay? It doesn't come from the outside, it comes from the inside. Now, that's why the medical approach, which is putting cortisone cream over the top of it, which does help with the inflammatory skin response because cortisone is an anti-inflammatory. The problem is it's superficial. What's happening with eczema is inflammatory products, inflammatory agents are coming through the skin to be excreted, and as they go through the skin, they cause reddening, hardening, and scarring of the skin as it comes through. So the key is, obviously, helping the body eliminate the toxins that are coming through the skin, but maybe not produce the toxins in the first place, right? So the question is, what are these inflammatory agents? Why do they form? Where do they come from? Well, the first one I always look at when it comes to my patients is I go after food. Because food allergens, you take them internally, they absorb into the body, and guess what they are? They are allergens, and they will cause irritation, inflammation. Now, some people will have that in the gut, or in their stomach, in their intestines. Some people will have it in their joints, but some people end up with it on their skin, right? So the goal is to try to figure out what those allergens are, right, and eliminate them. And when we do that, that really should help reduce the amount of inflammation, the size and scope of those rashes and those irritations, those lesions on the skin. All right. The other one that I use very much with patients is a yeast protocol. There's a yeast usually in the gut, in the large intestine, as an overgrowth. And so what I do is try and help send in things that are known to be antifungal. There are a lot of like pau d'arco, oil of oregano, thyme, grapefruit seed extract, caprylic acid, a variety of different products that are known to that yeast don't like to reproduce in, they don't like to live in, and they exit the body. And that's a positive thing. Now, we also usually use a protocol of weed. I use a protocol of weed and seed. We think of yeast like weeds in a yard. If we throw an herbicide on the yard to try and get rid of some of the clover, the dandelions, the thistles, and then we create some bare patches in the grass because we've killed those weeds, but now we need seed. So I throw some seed into those areas to try and help foster normal grass growth. So in a lot of cases of yeast overgrowth, we try and do what I call a weed and seed mentality, which means throwing antifungals into the body, but also throwing probiotics into there to try and take the spots vacated by the abandoned yeast. So what we have here now is we have food, right? And we have an antifungal approach. And what'll happen with people is you might have a patch on your arm, right? And you'll have this little circle rash. So what'll happen is it'll start to go away in the very thin areas, the very pinkish areas. But the middle areas are very thick and they'll take longer to go away. But as soon as you start seeing some of these areas clear, you'll know I'm on the right track. I'm going to keep going. And you'll want to go beyond when the rash goes away because we want to make sure that we take care of this completely. And you may need to, since you formed yeast in the first place, you may actually need to take a probiotic again to maintain this anti-yeast new protocol in your body, this you can't live here anymore kind of mentality, right? So eczema, it's horrible, it's itchy, it's painful, it's not fun, but it's curable. And more importantly, it's curable naturally from the inside out.
I remember the testimony of a woman who suffered from eczema on her hands. After going through a detox program and eliminating offending foods from her diet, the eczema completely disappeared. She was thrilled. It's refreshing to know that your body can spring back to health, and with the right approach, symptoms subside, and in many cases, you can be symptom-free. It's time to get to the root cause. Ask your wellness clinician about treatments for eczema.